Everyone and welcome back. So we are going to discuss the important procedures in the field of gynecology, and we will discuss the dilatation and curettage, the hysterectomy and the laparoscopy techniques. So starting from the dilatation and curettage. Dilating cervix to allow the passage of instruments into the uterine cavity, and curettage means removal of the endometrial tissue or contacts of uterine cavity with the help of the curette. The indications for dilatation and curettage are diagnostic and therapeutic. The diagnostic indications are endometrial tissue is obtained for the assessment of hormonal and pathological status of the endometrium. The indications are abnormal uterine bleeding, that is irregular menstruation, menorrhagia, intermenstrual bleeding, postcoital bleeding, and postmenopausal bleeding. The suspected malignancy of endometrium and cervix is a part of infertility workup for the diagnosis of endometrial infections like TB prior to conservative surgery on cervix or uterus like Manchester repair Lefort's operation to exclude the occult cancer. So these are the indications for the dilatation and curettage. These are the diagnostic indications. Now, the therapeutic indications are when performed to treat the clinical condition, that is abortion and heavy uterine bleeding, endometrial polyp, and misplaced intrauterine contraceptive devices. The different procedures are anesthesia and position, that is lithotomy position, and timing, that is performed premenstrually for the diagnosis of endometrial tuberculosis and infertility workup, and for pelvic examination, and the technique is the retraction of post-vaginal wall by Sims speculum and uterus stabilized by the fixing lips by valsalm forceps. The uterine sound pass to assess the position of the uterus and to measure the uterine cavity. Then the uterus is dilated up to 8 to 10 mm with Hager's dilator. Uterine cavity is explained with the polyp forceps during diagnosis, D&C, and with sponge holding forceps when performed for the treatment of abortion. Uterine cavity is curated with sharp curette for diagnostic or D&C and with blunt curette for abortion. Now, at conclusion of D&C for abortion, injection of 10 units of oxytocin and 0.5 mg ergometrin is given to enhance the uterine contraction to stop bleeding. Then specimen is obtained which is fixed in formalin for histopathology, and second specimen is preserved in normal saline for culture and sensitivity of the endometrial tuberculosis is suspected. The complications of dilatation and curettage are trauma, hemorrhage, infection, and secondary amenorrhea. So we have discussed the process of dilatation and curettage, and what are the indications of the dilatation and curettage. These are the diagnostic indications and the therapeutic indications. Then we have discussed the general procedure, that is anesthesia is given, then position the patient, then the timing and pelvic examination and the technique for it, and then the general procedure. Then we have discussed the complications of the dilatation and curettage, which is trauma, hemorrhage, infection, and secondary amenorrhea. Now coming towards the second procedure, that is laparoscopy. Laparoscopy is one of the major procedures in the field of gynecology, and the indications are both the diagnostic and operative. The diagnostic indications are infertility, endometriosis, pelvic inflammatory diseases, ectopic pregnancy, unexplained pelvic pain, primary amenorrhea, polycystic ovarian disease, and to localize the lost IUCD. The assessment of the pelvic mass is difficult to differentiate at ultrasound. It is done prior to IVF, prior to the reversal of the sterilization and congenital tract abnormalities, and second look procedure after malignancy and therapy and infertility surgery. So these are the diagnostic indications of laparoscopy. Now the operative indications are that it is a procedure on fallopian tubes. It is done for sterilization, peritubal adiolysis, salpingectomy or salpingotomy for ectopic pregnancy, and GIF or GIF procedure. The procedure on the ovaries is done, and it is done for ovarian cyst aspiration and oophorectomy, ovarian drilling or wedge results, and oocyte retrieval for IVF. Now the procedure on the uterus is done for myomectomy, hysterectomy, and endometrial ablation, and the other indications are retrieval of the lost IUCD and Calpo suspension and pelvic support procedure and pelvic and aortic lymphadenectomy. Okay, so this is the laparoscopy, and the procedure of laparoscopy is that anesthesia is given. Then the technique is that patient is placed in the lithotomy position and Trendelenburg position is maintained by tilting head side downward. The vulva, vagina, perineum, and abdomen are swept with pyodine, and the bladder is emptied using metal catheter. Then patient is covered with sterile towel and bimanual pelvic examination is done. And then the vagina is fixed with valsalem forceps and Rubin's cannula. This is the general procedure of the laparoscopy. Okay. Then small subumbilical incision is given with the help of the needle and trochlear laparoscope is inserted inside and camera is connected to the laparoscope and is seen through monitor. The complications of the laparoscopy are instrumental, that is trauma and incisional hernia, and pneumoperitoneum, which are emphysema and gas embolism and cardiorespiratory arrest, and then the operative procedures, which are thermal trauma, hemorrhage and infection, and the complications of the anesthesia are failed intubation and drug reaction and cardiac arrest. The contraindications are severe cardiorespiratory disease, severe intra-abdominal bleeding, generalized peritonitis, acute intestinal obstruction, large intra-abdominal masses, and untreated advanced malignancy. The rupture ectopic pregnancy and pelvic abscess, for this colpocentesis is performed, and for the drainage of pelvic abscess and sterilization colpotomy is performed. So we have discussed the laparoscopy. Then we have discussed the indications for it, which are both the diagnostic indications and operative indications. These are the diagnostic indications. The operative indications are procedure on fallopian tube, procedure on the ovaries, procedure on the uterus, and others. Then we have the procedure as anesthesia is given. Then the general technique is that patient is placed in lithotomy position, and the vulva lateral and blood position is maintained. Vulva, vagina, perineum, abdomen are swabbed with pyodine, and then the rest of the procedure is applied. Okay, now the complications of the laparoscopy are both instrumental and pneumoperitoneum and operative procedures, and the complications of anesthesia are also there. These are the contraindications. In these conditions, the laparoscopy should not be performed. These are severe cardiorespiratory diseases, severe intra-abdominal bleedings, generalized peritonitis, acute intestinal obstruction, large intra-abdominal masses, and untreated advanced malignancy. Now coming towards the next topic, that is hysterectomy. Hysterectomy is the removal of the uterus. We are having the type, that is abdominal hysterectomy, vaginal hysterectomy, laparoscopic hysterectomy, and cesarean hysterectomy. Now coming towards the abdominal hysterectomy, both the body of the uterus and cervix are removed. It is done in benign conditions and done in the case of malignancy of genital tract. The benign conditions are dysfunctional uterine bleeding, fibroid uterus, adenomyosis, pelvic inflammatory diseases, chronic pelvic pain, endometriosis, chronic inversion of the uterus, septic abortion, benign ovarian tumor in elderly women. Now, the malignancy of the genital tract are the causes of body of uterus, endometrial cancer, uterine seroma, choriocarcinoma, cancer of the cervix, ovarian cancer, and carcinoma of the fallopian tubes. Then the cesarean hysterectomy is done, and it is indicated in emergency, that is severe postpartum hemorrhage and not responding to medical treatment, and the uterine rupture not suitable for repair, and placenta accreta. Then we have elective indications, which are genital causes coexisting with pregnancy, and menorrhagia existing from before pregnancy, which is a rare indication. The procedure is that first of all the anesthesia is given, then the technique is the complications. The technique and the complications are of that of like laparoscopy, immediate complications, and delayed complications we have in the hysterectomy. Vaginal hysterectomy and laparoscopic hysterectomy, and these are the types of the hysterectomy. So the indications, the prerequisites, the procedure, anesthesia, and the technique, complications, all are of the same as that of the abdominal hysterectomy. So we have discussed the three main procedures, that is the first one is the dilatation and curettage, D and C, and the second one is laparoscopy, and the third one is hysterectomy. These are the major procedures that are done in the field of gynae, and we should know a little bit introduction about these procedures. We have left the one topic, that is the ovarian cyst or tumors. So in the next section we will discuss this topic. Thanks for watching.